Did you know that half of all men will face prostate issues by the age of 60? That's right, and the chances only increase with age. But what really happens to your prostate as you age? And are there ways to prevent or minimize these problems? Let's dive deep into prostate health, debunk myths, and discover together how you can keep this crucial gland in excellent shape. Subscribe to the channel for more updates and enjoy this video if it is useful to you. There's another way to support our content. See the comments. Make a difference to someone's health by enjoying this video. Your collaboration helps us bring health information to more people. Prostate health is a fundamental aspect of male well-being, often underestimated until serious problems arise. This walnut-sized gland, located just below the bladder, plays a crucial role in male reproduction, producing fluid that nourishes and transports sperm. As you age, it is common for the prostate to increase in size, a condition known as benign prostatic hyperplasia, BPH, which affects about 50% of men by the age of 60 and up to 90% of men over 80. Prostate issues can range from mild inconveniences to severe conditions that significantly affect quality of life, making prevention and early diagnosis essential. Statistics show that, in addition to BPH, other conditions such as prostatitis and prostate cancer are also major concerns. Prostate cancer, for example, is the second most common type of cancer among men in many countries, highlighting the importance of constant vigilance over the health of this gland. However, despite its prevalence, there is good news. If detected early, the chances of successful treatment and effective symptom management are very high. Therefore, it is vital that men pay attention to the body's signs and regularly consult their doctors for routine exams, contributing to the maintenance of prostate health. What is benign prostatic hyperplasia? Benign prostatic hyperplasia, BPH, is a common medical condition that affects the prostate, a small and vital gland located below the bladder in men. It is characterized by non-cancerous growth of the prostate, which can lead to compression of the urethra, the channel that carries urine from the bladder out of the body. This increase in size is generally considered a normal part of male aging, although not all men will experience significant symptoms. BPH is not associated with prostate cancer. However, it can cause discomfort and complications if not treated appropriately. Symptoms of benign prostatic hyperplasia are mainly related to changes in urinary function and can vary in severity. The most common include increased urinary frequency, especially at night, nocturia, difficulty in starting urination, a weak or intermittent urinary flow, and the sensation of incomplete bladder emptying. In more severe cases, BPH can lead to urinary blockages, urinary tract infections, and even kidney damage due to prolonged urinary retention. It is crucial that men with these symptoms consult a doctor for proper assessment and, if necessary, treatment to improve quality of life and prevent more serious complications. Common causes of prostate problems. Prostate problems, including benign prostatic hyperplasia, BPH, prostatitis, and prostate cancer, can be influenced by a combination of genetic and environmental factors. Genetically, the predisposition to certain prostate conditions can be inherited, with studies indicating that men with a family history of prostate problems are at a higher risk of developing these conditions. For example, a man whose father or brother has been diagnosed with prostate cancer is at a significantly higher risk of developing the disease. Additionally, research suggests that certain genetic mutations and variations may increase susceptibility to prostate problems, reinforcing the complexity of the interactions between genetics and prostate health. On the environmental side, factors such as diet, lifestyle, and exposure to toxins play crucial roles in prostate well-being. Diets high in saturated fats and red meats have been linked to a higher risk of prostate cancer, while foods rich in antioxidants and fibers may offer relative protection. Sedentary lifestyle is also a known risk factor, as the lack of regular physical activity can contribute to the development of various health conditions, including prostate problems. Furthermore, exposure to certain chemicals and environmental pollutants has been investigated for their possible link to an increased risk of prostate cancer, highlighting the importance of considering both internal and external factors in maintaining prostate health. Prostate problem. Diagnosis. The diagnosis of prostate issues typically begins with a detailed clinical evaluation, in which the doctor discusses the patient's symptoms and performs a physical exam, including a digital rectal exam. This exam allows the doctor to directly feel the prostate through the rectal wall to check for any enlargement, hardening, or irregularities that may indicate conditions such as benign prostatic hyperplasia, BPH, or prostate cancer. In addition to the physical exam, doctors often request blood tests to measure levels of prostate-specific antigen, PSA. While an elevated PSA level can indicate inflammation, infection, or growth of the prostate, it is not solely indicative of cancer, and elevated values may require further investigations. For a more detailed assessment, imaging methods such as transrectal ultrasonography, which uses sound waves to create an image of the prostate and help identify abnormal areas that may need a biopsy, are employed. Magnetic resonance imaging, MRI, of the prostate is also increasingly used to provide detailed images and aid in the identification of prostate cancer. In cases where these analyses suggest the presence of tumors, an ultrasound or MRI-guided biopsy may be performed to confirm the diagnosis. This integrated approach, combining clinical assessment, laboratory testing, and imaging techniques, enables accurate and targeted diagnosis, facilitating a more effective treatment plan for each patient. Conventional treatments for enlarged prostate. The treatment of an enlarged prostate or benign prostatic hyperplasia, BPH, varies according to the severity of symptoms and the impact on the patient's quality of life. For milder cases, treatment may begin with pharmacological approaches. There are mainly two classes of medications used: alpha blockers, which relax the muscles of the bladder and prostate to facilitate urine passage, and 5-alpha reductase inhibitors, which help reduce the size of the prostate by blocking the hormonal conversion that stimulates prostate growth. These medications can be effective in relieving symptoms and are often the first line of treatment recommended by doctors. In cases where medication is not sufficient to relieve symptoms, or if there are significant complications, such as recurrent urinary retention or urinary tract infections, surgical options may be considered. Surgical techniques to treat BPH include transurethral resection of the prostate, TURP, which involves removing part of the prostate through the urethra, and laser enucleation of the prostate, which uses laser energy to remove excessive prostate tissue. Both techniques aim to relieve pressure on the urethra and improve urinary flow. These interventions are generally safe and effective, providing lasting relief for many patients, although like any surgical procedure, they may carry risks and require a recovery period. Role of diet in prostate health. Diet plays a crucial role in prostate health, and certain foods can have significantly beneficial or detrimental impacts. Foods rich in antioxidants, such as colorful fruits and vegetables, are particularly beneficial due to their anti-inflammatory and antioxidant properties. Tomatoes, for example, are valued for their high concentration of lycopene, an antioxidant that has been associated with reducing the risk of prostate cancer. Additionally, foods rich in omega-3 fatty acids, such as fatty fish, salmon, mackerel, sardines, and flax seeds, are known to reduce inflammation in the body, including the prostate. These nutrients help maintain prostate health, potentially reducing the risk of issues such as BPH and prostatitis. On the other hand, diets high in saturated fats and red meats have been linked to an increased risk of prostate cancer. High consumption of dairy products has also been linked to a higher incidence of prostate problems. These foods can promote the production of hormones and inflammatory compounds that exacerbate prostate growth and disease occurrence. Thus, a balanced diet with reduced consumption of red meats and dairy products, prioritizing healthier protein sources and plenty of vegetables and fruits, is recommended. Adopting a Mediterranean dietary approach, which includes many vegetables, fruits, whole grains, and healthy fats, can be particularly beneficial for overall health and prostate health. The miracle fruit. Myths and truths. In the world of health and nutrition, claims often arise about superfoods that supposedly have miraculous benefits, including the ability to reduce the size of an enlarged prostate. One of the most cited foods in this context is the tomato, due to its high content of lycopene. Studies suggest that lycopene, a powerful antioxidant found in tomatoes, may help reduce the risk of developing prostate cancer and even aid in reducing disease progression. However, it is important to note that while regular consumption of tomatoes can be beneficial as part of a balanced diet, it is not a cure or a treatment in itself for existing prostate issues. Another miracle fruit often discussed is pomegranate. Laboratory research and some small clinical studies suggest that compounds in pomegranate may have anti-inflammatory and antioxidant effects that potentially benefit prostate health. It is believed that the polyphenols present in pomegranate help fight the growth of prostate tissue and may reduce PSA levels. Despite these promising findings, it is crucial to understand that more studies are needed to confirm these effects on a larger scale, and that consuming pomegranate alone does not replace conventional medical treatments for prostate conditions. Lastly, soy is another frequently mentioned candidate due to its isoflavones, which are phytoestrogens capable of mimicking the action of estrogen in the body. Some studies suggest that isoflavones may help in preventing prostate cancer, possibly through the modulation of hormone levels. However, as with other foods, the impact of soy on prostate health is not conclusive and should be seen as part of a healthy lifestyle and diet, not as an isolated treatment. In all these cases, it is vital to maintain realistic expectations and understand that no food is miraculous enough to treat medical conditions without the support of other health interventions. Foods to avoid for a healthy prostate. To maintain prostate health, it is crucial to be aware not only of beneficial foods, but also of those that may aggravate prostate problems. Foods high in saturated and trans fats, such as processed meats, fast food, and fried foods, are known to contribute to increased inflammation in the body, which can negatively affect prostate health. Diets high in these fats have been associated with an increased risk of prostate cancer and can exacerbate symptoms of benign prostatic hyperplasia, BPH. Moreover, excessive consumption of red meat, especially when prepared at high temperatures, can generate compounds that promote tumor growth, posing an additional risk to prostate health. Another group of foods that deserves attention are dairy products, which, when consumed in high amounts, have been linked to an increased risk of prostate cancer in some studies. Additionally, excessive intake of alcohol and caffeine can disrupt hormonal balance and irritate the bladder and prostate, leading to increased urinary frequency and other urinary discomforts in men with BPH. Therefore, moderation in consuming these substances is recommended. Adopting a diet rich in fruits, vegetables, whole grains, and healthy fats, while limiting the intake of inflammatory and high-fat foods, can significantly contribute to prostate health. Supplements and beneficial nutrients. For the prostate. For the maintenance of prostate health, various nutrients and supplements have been studied for their potential benefits. Among them, zinc stands out as a crucial mineral for prostate health. Zinc is found in high concentrations in the prostate and plays a vital role in processes such as DNA production and cell repair, as well as acting as a natural anti-inflammatory. Studies suggest that adequate zinc intake may help regulate cell growth in the prostate and potentially prevent the progression of prostate diseases. In addition to zinc, selenium is another mineral that has been linked to prostate health, with research indicating that it may help decrease the risk of developing prostate cancer. Besides minerals, vitamins play an important role in prostate health. Vitamin D, in particular, is essential, as its cell growth regulating properties may help prevent the development of prostate cancer. Epidemiological studies show that low levels of vitamin D are correlated with an increased risk of prostate cancer. Similarly, vitamin E, known for its antioxidant properties, has been studied for its potential to protect against prostate cancer, although the results are mixed and suggest that supplementation should be approached with caution. Additionally, adequate intake of B vitamins is also recommended for general health support and cellular functioning. These nutrients can be obtained through a balanced diet, rich in fruits, vegetables, nuts, and grains, or through supplements when indicated by a health professional. Lifestyle and prostate health. A healthy lifestyle can have a significant impact on prostate health. Regular physical activity is one of the most important factors, as it helps maintain optimal body weight, reduces the risk of diabetes and cardiovascular diseases, and may even lower the risk of developing prostate cancer. Moderate to intense exercises such as brisk walking, running, swimming, or cycling are particularly beneficial. These activities improve overall blood circulation and can help reduce inflammation, a factor that contributes to prostate growth and associated problems. Studies suggest that men who exercise regularly have a lower chance of developing severe prostate problems, including cancer. In addition to physical activity, stress management plays a crucial role in prostate health. Chronic stress can adversely affect the immune system and alter hormone levels, which may influence prostate function and potentially contribute to health issues. Stress reduction practices such as meditation, yoga, or deep breathing techniques can help decrease stress and improve overall health. Sleep quality is also essential, as lack of adequate sleep can lead to increased stress and decreased immunity. Therefore, adopting practices that promote quality sleep and a less stressful lifestyle is crucial for prostate health and overall well-being. Prevention of prostate diseases. Preventing prostate diseases involves a combination of dietary approaches, lifestyle, and regular medical surveillance. Diet plays a crucial role in prevention, with an emphasis on including foods rich in antioxidants, fibers, and essential nutrients, which can help reduce the risk of prostate issues, including cancer. Foods like tomatoes, rich in lycopene, dark leafy greens, fruits, nuts, and seeds, as well as sources of healthy fats like olive oil and omega-3 rich fish, should be regular components of the diet. Avoiding or limiting intake of saturated fats, red and processed meats, and high-sugar foods is also recommended, as these can contribute to an increased risk of prostate cancer and other health conditions. An active lifestyle is another crucial pillar in preventing prostate diseases. Regular physical activity not only helps maintain a healthy weight, but also reduces the risk of developing chronic conditions that can affect prostate health, such as type 2 diabetes and cardiovascular diseases. Exercises can be adapted to individual abilities and preferences, but the key is to stay active. Incorporating activities such as walking, running, cycling, or even strength and flexibility exercises can make a significant difference in maintaining prostate health. In addition to diet and exercise, regular medical checkups are essential for early detection of prostate issues. Men over the age of 50, or those with high-risk factors, such as a family history of prostate diseases, should undergo annual exams that may include PSA, prostate-specific antigen tests, and digital rectal exams. These tests help identify any abnormalities or changes in the prostate that may indicate early problems. Open communication with a healthcare professional about any urinary symptoms or changes can also aid in the effective management and treatment of prostate conditions before they progress. By adopting these strategies, it is possible to significantly reduce the risk of prostate diseases and promote a longer, healthier life. Demystifying myths about prostate health. There are many myths and misunderstandings circulating about prostate health that can confuse and even cause unnecessary anxiety. One common myth is the idea that prostate issues are only a concern for older men. While it is true that the risk of conditions like benign prostatic hyperplasia, BPH, and prostate cancer increases with age, younger men can also be affected by prostate issues, especially prostatitis, which can occur in men of all ages. This myth can lead to complacency, causing younger men to ignore relevant symptoms and delay seeking diagnosis and treatment. Another prevalent misconception is the belief that high sexual activity can cause prostate cancer. There is no scientific evidence to support this claim. In fact, some studies suggest that frequent ejaculation may be associated with a reduced risk of prostate cancer. This myth can cause unnecessary stigma and anxiety and misinform men about the true risk factors for prostate cancer, such as genetics, diet, and lifestyle. It is important for men to understand that healthy sexual activity is part of a normal life and should not be viewed as a risk factor for prostate diseases. Finally, there is the false notion that a digital rectal exam is the only method to detect prostate issues. While the digital rectal exam is an important diagnostic tool, it is not the only method available. Blood tests to measure PSA levels, transrectal ultrasound, and biopsies are other tools that doctors use to assess prostate health. Avoiding medical exams due to discomfort regarding the digital rectal exam can lead to late diagnoses and fewer treatment options. It is vital that men discuss all available diagnostic options with their doctors and undergo regular screenings as recommended for prostate health maintenance. Throughout this discussion, we've highlighted the importance of prostate health and how various factors, including diet, lifestyle, and medical surveillance, play crucial roles in the prevention and management of prostate issues. Adopting a diet rich in antioxidants, fibers, and essential nutrients such as lycopene, omega-3, and zinc can help reduce the risk of prostate diseases, while limiting the intake of saturated fats, red meats, and dairy can prevent the worsening of these conditions. Additionally, maintaining an active lifestyle through regular exercise and stress management contributes significantly to general and specific prostate health. These practices not only improve prostate function, but also promote overall well-being. It's also essential for men not to neglect regular health screenings, including medical appointments for PSA tests and digital rectal exams, as recommended by health professionals. Such exams are crucial for the early detection of issues like prostate cancer, allowing for more effective and less invasive interventions. Debunking myths and educating oneself about the true risk factors and prevention methods are important steps in maintaining prostate health. By integrating these practices into their daily routines, men of all ages can significantly improve prostate health and, by extension, their quality of life. So, are you taking good care of your prostate? Remember, your health is an investment, not a cost. If you enjoyed these tips and want to continue improving your health, don't forget to subscribe to the channel, give that like, and hit the bell to not miss our upcoming videos. So, which of these tips are you going to start implementing today? Comment below, we're curious to know. See you in the next video. Until then, stay healthy and active.